Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hi, everyone, and thank you for joining us today. Today, we're going to talk about something that's been in the news and the media a lot, a hot topic, and that's weight loss medications. But first, before we get started, let's start off with our parent question.
Hi, I'm Kim. My daughter is 13 and has been heavy pretty much her entire life. Can she take weight loss medication to help lose weight and be healthier?
Thank you, Kim. I feel for you and your daughter because this is an important topic that the whole world is dealing with. And what's really important to know is that it's not an appearance issue, it's a health issue and something that's so important for all of us to learn and think about to help promote the best health for our kids. Here today to talk about this very important topic is Dr. Margaret Stefater Richards. Dr. Margaret Stefater Richards is a physician and researcher here at Boston Children's Hospital's Division of Endocrinology. Thank you for joining us and welcome.
It's nice to be here today. Thanks for having me.
Thank you for coming, and I'm really excited to deep dive into this topic. But before we get started, I'm actually thinking it might be helpful to hear what is an endocrinologist, because that may not be a type of physician that many are familiar with.
So endocrinologists are doctors who specialize in understanding how hormones really regulate different processes in our body and how when these hormones have imbalances, they might contribute to health problems. So disorders that we treat include things like diabetes, thyroid disease, short stature, and actually also obesity. Believe it or not, our hormones actually help to control how our body stores and burns fat.
So hormones are important for, all aspects of our bodies.
Yeah, absolutely. Yeah.
Well, that's amazing. Yeah. So how did you get into taking care of patients who have hormone challenges?
Yeah, I always thought that this sort of concept of regulation was really interesting, but in particular, how these hormones regulate weight, because we know a lot of people struggle with this.
So given today that we're talking about childhood obesity, could you help us really understand or define what is obesity?
Obesity occurs when a child's weight is above the ideal level for their height. In adults, actually, obesity refers to a BMI of 30 or higher. But in kids, because height is always changing, we actually define obesity as a body mass index of the 95th percentile or greater than 95% of other children. And actually, obesity was recognized by the National Institutes of Health as a disease back in 1998.
Yeah, BMI is such an important piece in terms of understanding, right, and how to classify or define obesity. I definitely, as a person of short stature, have found it challenging, right, because my BMI shows that I am in the obese range in terms of definition, but I know there can be some variability. How do you define obesity maybe for those that may not fit within the average ranges?
Yeah, so it's a great question. BMI is imperfect. It's just one of a constellation of things that doctors are looking at to understand someone's health. And we know that, in medical studies, a higher BMI tends to be correlated with metabolic problems or part of a metabolic disease. But it doesn't mean that it's the only thing that we're looking at.
That makes sense. Yeah. So it's all about health, really, is what we're talking about, and sort of looking at those different factors that may suggest someone has, a health issue related to their weight. One of the things that I think folks often think about when they think about obesity, too, is the body image piece. How do you differentiate, obesity as a health problem versus body image?
I think it's really important for doctors to be, and for patients to be clear, this is a medical term.
Yeah, we're talking about it because it's so important for your health.
It's really important for doctors to be centered on the patient as a person and to recognize that can be really triggering terms for people. And to clarify that when we're using these terms, we're really focused on the health on the inside rather than somebody's shape or size on the outside.
That's really important. That makes sense. So much sense. So thinking about our topic today in terms of obesity, what data is there that we should know about, in terms of obesity in the U.S., particularly for kids?
Obesity is really prevalent. It affects over 40% of adults in this country and almost 20% of children, which is staggering when you think about it. If you think about any other disease, we would be shocked if it affected that many people. The rate of childhood obesity has more than tripled since the 60s.
Wow. So that's a lot when you think about those numbers. And I'm just curious too, in terms of knowing how significant of a health problem this is. Are there any, sort of risk factors or, sort of different populations of kids that have more of a risk?
Yeah, so demographically, we know that Hispanic kids and Black kids are more frequently affected by obesity. But this is not the whole picture. I think we have to look at the environment. Many kids are living in an environment that makes it hard to get out and play and have physical activity, or in neighborhoods or communities where it's difficult to have access to healthy foods. And in general, in our society, many times cheaper foods are less healthy for us, more calorically dense.
So true.
Yeah. But we know that our genetics and actually even experiences that we may have before we're born in utero may actually make it harder for some people to maintain a healthy body weight than other people, even with the same environment.
Of course, I'm fascinated by that as a neonatologist about how, there's so many origins of health problems, in childhood and adulthood that really start in that fetal period. So it's pretty,
absolutely.
It's pretty just remarkable how much we're learning about how things happen. Just so we all sort of understand sort of like obesity in general, what are the things that cause obesity for kids?
Right. So there are many causes of obesity in kids, including medical and genetic factors. We know in general the rise in obesity in this country is largely due to living a more sedentary lifestyle and changes in our diet, which maybe are not so optimal. What I think is important for patients to understand is that once we've gotten there, it can be really hard to lose weight, right? Our bodies want to defend our level of fat mass. And so this is not just about self-control or willpower. I really don't love those terms in general. These are things that we definitely pay a lot of attention to in clinic. But we also think about other factors that may be at play. We all have genetics that influence our level of body weight, whether that's in the high or in the low range. And as I said, even these prenatal experiences can contribute. So it's complex. Often when really young children are suffering from very severe obesity, we're really looking more deeply at whether there might be a single gene that might contribute to that, or whether a medication that a child's on may be adversely influencing their weight trajectory.
From that toddler stage through adulthood, this is just an important piece of health, and looking at the whole child is great.
Yeah, and one reason why we pay attention so early is that we know that once you sort of get to that elevated BMI status, it could be really hard to get back from that. And so paying attention to a healthy lifestyle very early on is extremely important.
Yeah. So important. So it's never too early to have that conversation with your physician. Yeah. That's great. Yeah, it's very complex, like almost all really chronic diseases, right? It's got a lot of factors that cause it risk. There's both the biological and the environmental, and so it makes it really hard to tackle.
Yeah.
So thinking about how hard it is and how prevalent it is as a illness for as a disease state for our kids. What are the long-term consequences that we should be aware of for childhood obesity?
So we know that having obesity as a child can dramatically increase the risk of having obesity as an adult. It can also increase the risk of certain medical conditions like type 2 diabetes, heart disease, and really even some cancers.
Yeah, there's definitely a lot that you hear about recently, right, about how many cancers are linked to obesity. And so, like you said in the beginning, this is a health issue, so we have to treat it as such.
Absolutely.
Obviously, this is a health problem. It affects your physical health, but what about your psychological and mental health? How big of an impact do you see for patients?
Yeah, so obesity can have a huge impact on psychosocial health, including increased risk of depression, social isolation. I think stigma around obesity really makes this really difficult.
Yeah, so again, very complex in terms of the impact that it can have on an individual. So knowing that, 20% of our kids are challenged with childhood obesity. It's such a complex disease, and its impacts are so huge in terms of mental and physical health. How can we help our kids? Where can we go from here in terms of treatment options to help our kids be healthy?
Yeah, great question. And there's no one right answer. Just last year in January of 2023, the American Academy of Pediatrics put out its first set of comprehensive guidelines in 15 years around treatment of obesity. And for the first time, these guidelines recognize not only the importance of really paying close attention to physical activity and nutrition, but also recognizing that there may be an important role for weight loss medications as well as bariatric surgery. They recommended thinking about medications in patients 12 and up, and potentially even bariatric surgery in selected patients 13 and above.
So there's lots of options now, and it's exciting to hear that the AAP is coming out with these guidelines, because I'm an neonatologist now, but I think about my general pediatrics training, and I remember, in my residency, bariatric surgery as a treatment option for children with childhood obesity was very new and even controversial at some point. It's so important to think about this, again, as a health problem to help our kids be as healthy as possible. So it's just amazing to hear from you sort of like how many options there are and where we've come from when even I was a resident taking care of pediatric patients back in the day. Obviously, today we're here to talk about the medication piece. So it's good to know that we have all these options. But, how do you think about medications to treat childhood obesity?
So we actually have 4 options that are FDA approved in children ages 12 and up. And those include the medications Wegovy, Saxenda, Orlistat, and Qsymia. Wegovy and Saxenda are actually newer medications. These were actually first used as diabetes medications, but can help dramatically to help regulate weight.
I also didn't hear from you about Ozempic, which is the one everybody hears about and talks about today.
Yeah, so Ozempic is actually the same medication as Wegovy.
Okay.
Ozempic is for diabetes, and Wegovy basically comes in a different package for weight loss.
So same medication, just different indications.
Absolutely.
Okay. Yeah. Now you've clarified it for me. Thank you. It would be great to take a deep dive to understand, the two, because there's 2 different types, right? Mm-hmm. So the 2 different types or categories and how they work differently.
Wegovy and Saxenda are both medications that are part of this class called GLP-1 agonist. So that is a big word for, it's a hormone called glucagon-like peptide that is normally made in our intestines and helps us to feel full. And it also, by acting in the brain, and also by helping the stomach to empty more slowly. And these medications basically act just like that hormone.
Hormones are important, so this is a medication that really acts like a hormone.
Yeah,
and
absolutely.
Helps your body regulate from the brain to your intestine.
Absolutely. And then we have Qsymia, which was is actually an older medication that has been used in adults for quite some time. It's a combination of two medications called phentermine and topiramate. This combination medication was actually just recently FDA approved for use in children ages 12 and up. Wow. And these medications also act largely in the brain to help us feel more full between meals and fuller quicker when eating. There's also a fourth medication called orlistat that helps to prevent our bodies from absorbing fat. But they can have a lot of unpleasant side effects, so we don't use those quite as much.
Yeah, we don't, although many of our audience probably enjoy talking about diarrhea, we don't have to talk about that today. Or I should say my family enjoys talking about diarrhea because I have 2 teenagers. That makes sense. So that's a totally different class of medication.
Right. Absolutely.
So knowing that there's those 3 different sort of categories, 4 different medications approved in kids, used in kids, how do you decide which one to prescribe?
Yeah, that's a great question. Usually I like to present, multiple options to patients. The newer medications, the GLP-1 receptor agonists, which include Wegovy and Saxenda, tend to be a little bit more potent in the amount of weight loss that they elicit. And so those can be nice options. They can also be really nice options for people with diabetes and maybe even for people with polycystic ovary syndrome.
Great. So some positive benefits for other health issues.
Exactly. They do have some negative side effects that we need to think about. And of course, if somebody has, certain health conditions that might steer us more towards another medication, like Qsymia, for example, or even the components of Qsymia used separately in some cases. We also do have patients who are old enough who might be considering pregnancy. So none of these medications are really ideal in that scenario. And insurance coverage is unfortunately something that we have to consider as well.
Yeah, so let's deep dive about that, because I think, one of the things that I used to hear is that many public health insurance companies didn't cover these medications, but I understand that the landscape is changing because of the health benefits.
Yeah, and the landscape is changing so rapidly that it's difficult to keep up with, as you can imagine, because these medications are very new. We know that there is a lot of variability in between different health plans, both private and Medicaid or Mass Health, where some medications might be covered and others may not be covered. And we really don't know until we really ask the insurance company to cover the medication. But unfortunately, it's leading to worsening health disparity that's already there.
And it's good that we're seeing the landscape change and that there's improvements towards coverage, but it's really important that we get there to get it fully covered so that there's not that health disparity. Aside from the diarrhea risk, which, of course, sorry, I couldn't help myself but saying that again. I'm curious, what are the risks and or side effects of the different types of medications?
Yeah, so the Wegovy and Saxenda, these newer medications, really the most common side effects that we see in probably a large percentage of people is nausea and sometimes even vomiting. And these can be limiting side effects that sometimes might steer us away from the medication after a trial period. But many patients are actually able to tolerate these medications very well, and these side effects often go away over time after being on the medication for a little bit.
So it's almost like some of those things you just have to kind of hang in there for.
Yeah, and we kind of start low with the dosing to help people get used to that and help minimize the side effects.
And then from a risk perspective too, are there any medications that you wouldn't want to prescribe in certain populations?
Yeah, sure. Again, with Saxenda and Wegovy, animal studies show us that there may be increased risk for something called medullary thyroid cancer, particularly in people with a family history of that cancer or related genetic syndromes. And so somebody has that family history, we probably wouldn't use that medication.
Got it. Okay. But it doesn't sound like a huge safety profile concern for most of these
I mean,
medications?
in general, these medications look fairly safe, especially given how efficacious they are in helping to regulate body weight in a way that we hope is preventing many, concerning medical issues down the line. However, really, these are newer medications. Yeah. And so we do counsel families that, studies have looked at patients on medications for a few years and not for decades at a time, right? Yeah. When we're seeing a teenager, they may need to be on medications for the next several decades. Yeah. And we don't know what the consequences are, but we do know at this point in time we have medication that can potentially help to avoid complications of obesity that we know are a strong risk.
Yeah, and the fact that we can now, and these are options that we're evaluating and being able to use in the pediatric population.
Absolutely,
not just the adult, which is what you hear about, right?
Yeah, it's a game changer.
Yeah, it's exciting for kids.
Yeah.
So thinking about that sort of potential need for long-term use, and if you were to stop the medication, I've heard, in the adult world of individuals regaining weight. So what do we know about that in kids or adolescents?
The studies that were done in children with these medications did show that although they can be very effective, when you stop the medications, people tend to regain the weight. And I think this is consistent with what we know about how our body regulates weight, right? Our body hangs on to a certain set point where it really wants to be. And, the medications help to reset that, but not permanently.
So something we have to keep an eye on.
Yeah. So we have a chronic health condition. It requires chronic treatment, just like any other chronic health condition, like high blood pressure or high lipids, for example. And I should mention, although we have these drugs that can really make a huge impact on health, they don't work in isolation. Yeah. We have to work on increasing physical activity, really paying attention to nutrition at the same time. We don't think that they, we know that they don't work without also modifying lifestyle.
Yeah, so like so many things too, right, that are chronic health conditions, it's a multi-prong approach. So it's sort of like you have to have the increases in activity, but also the healthy eating, and then these medications, though, can be really a game changer when you combine all that together.
Yes,
so
absolutely.
That's really important. Knowing how helpful it seems and important these medications are to that approach. I've heard a lot for those that have difficulty getting access to the medication, that they are trying dupes, that they're maybe seeking the medications from other places that aren't through their physician, and that worries me as a clinician and a parent, that there could be safety issues. And so I'm just curious if you could share with our audience more about what that looks like and how we could avoid that.
Yeah, it's such an important issue, and I think there's been so much demand for these medications. Yeah. There's been a short supply. They can be hard to find at the pharmacy, that many patients are turning to these dupes. And it can be hard as a patient to know, whether those dupes are safe, because they might be advertised in social media or other places. But really, patients should only buy a medication that is prescribed by their physician and dispensed by a pharmacy. These medications come in pens. Anything that comes in a vial is not safe, and they could really have anything in them.
Yeah. So you don't know what you're injecting your body with, really. Mm-hmm. Oh, gosh.
Yeah. So I would encourage patients only to obtain these medications when they're established for providers.
Yeah. No, I think that's really important, especially in the population we're talking about, right? Preteen, teen, adolescent, young adults, and they're all on social media, and so have access to viral, information about how to get the medication without having to go through your doctor, and that's really scares me. Yeah. It's definitely very dangerous, so important to know. Talk to your doctor. Don't go to social media for that. I want to sort of deep dive into, thinking here how we treat childhood obesity at Boston Children's. And I was wondering if you could sort of walk us through what our program here looks like.
Yeah, so we actually have several hospital-based programs here at Boston Children's. One is the Optimal Wellness for Life program, or OWL program, which treats kids from 2 to 18.
Okay. Wow.
And really focuses on diet or nutrition and physical activity, lifestyle changes, but may use medications as well as an adjunctive therapy.
I think it's so fascinating and so great that we have a program that thinks about sort of weight as an important sort of measure of health from as early as 2. I'm just wondering if our audience is wondering, so how is that an important piece for those younger patients?
Yeah. Of course, we may or may not use medications depending on a patient's age, right? Usually 2-year-olds are not treated with medication, right? Given that we don't have those tools for really young children.
So what about, probably what's a larger population, teens and adolescents?
Yeah.
Are there other programs for them as well?
Yeah, that's a great question. So in addition to the OWL program, we are treating patients within the endocrine division as a whole. There are also other specialists in other programs, such as cardiology, like our preventative cardiology program, which may focus on individuals, for example, with high cholesterol and high lipids or hypertension. We also have the adolescent bariatric surgery program, which is for adolescents who might be considering a surgical approach. So patients might come to Children's with the idea that they want to have bariatric surgery, or might have made that decision in the context of another program. Of course, we never start with surgery. We're, again, always starting with these lifestyle changes. And actually making these changes is incredibly important prior to bariatric surgery. But regardless of what program, a patient might be a part of, this multidisciplinary, comprehensive approach is really important, including nutrition and mental health and an emphasis on exercise as well.
That's really great. And it's just, it seems to me so similar, right, to so many health issues that we've talked about here in this podcast in terms of, how it takes a multidisciplinary approach and all of those different experts to help care for the child holistically. This is no different. And you're also sort of thinking about, what are all the different options in terms of that treatment plan, and starting off with the most impactful and important, but also the least invasive a risk, and then sort of thinking about, that treatment plan with the best, the best of intentions for what's needed for a child that causes the least harm. So what you didn't talk about, though, yet is where the medications might fit into the holistic approach for patients here at Boston Children's. Can you tell us more about how that fits in as well?
So weight loss medications are used in many of our programs and are used really as a part of this comprehensive treatment plan. It's not the whole picture. And we're constantly working to try to think about all of the new data and how to incorporate new treatment strategies as they become available.
Again, it's that holistic approach and thinking about the right treatment for the right child at the right time.
Yes.
Yeah, that's really important.
Absolutely.
Okay, so one thing we haven't talked about that I wanted to talk about, or just, get your perspective on, is, knowing that childhood obesity is such a challenge in our country and even globally for kids. How does that intersect with eating disorders? I can imagine that there's probably a connection and or a challenge to treatment.
Yes, that's a huge concern. And actually, these medications can be really dangerous if a patient has an eating disorder or a developing eating disorder. This is why mental health is such an important part of our treatment plan, really within any of our programs. It's a topic that can be difficult for some patients. It can be hard to talk about, and many people are embarrassed if they have disordered eating. But I would encourage patients to really be open with their team. The team is really wants the patient to be successful and to feel good about themselves. And so it's really important to just be open about those things.
Yeah, and to keep that as part of the overall picture that you're thinking about as you're helping
Absolutely.
a patient who may be suffering from obesity.
Yeah, absolutely. And I should mention, people think about binge eating disorder when they think about obesity, but people with obesity can also have restrictive eating, which we worry about a lot with these medications that reduce appetite. So we need to be really careful. And if there's any concern, we may not go in that direction.
Yeah. So it's really important to have that personalized approach and that holistic approach.
Absolutely.
So, as we wrap up our conversation here, one of the things that I always love to learn from our experts is, tell us where the research is going. Where, what is the future in terms of, treatment of childhood obesity and or what you're seeing related to the medication approach? Anything that you'd like to share from a research perspective?
There are many medications that are being studied that are currently on the horizon, but also a lot of opportunity is still there. And in my lab, we are trying to understand how bariatric surgery works with the hope that we could pave the way for new medications down the line.
That's great. So really just understanding more about those treatment options and how to apply them is really the next frontier. And I think that would apply to adults and kids. So
yeah, I hope
it's exciting to know that your research is focused on that. That's great. Well, we've talked a lot today. Is there anything that we really haven't touched upon related to childhood obesity, the medications evolving, that we haven't shared yet with our audience?
It's really important to think about not just what the medical data is telling us, but really where a child is in their treatment journey and whether they're in the right mindset to have treatment at that time. Yeah. And so really meeting patients where they are is incredibly important. And maybe now is not the right time for medication for a particular patient, but maybe readdressing that in several months or even years might be more appropriate.
That makes sense, because what's really important, it sounds like, with all of these different aspects of care, you have to have that readiness. You have to...
Right. We want to set our patients up for success.
That's right. That's right. It's really great. Here at the end, we always ask our expert to, prescribe in doctor's orders one thing that parents can do to help, promote a healthy lifestyle for their children. And so I was wondering if you could share with us, what would be your doctor's orders today?
So a healthy lifestyle, you said it, staying active. For kids, playing, whether that's outside or inside. Yes. And really a healthy relationship with food. Regardless of whether you need medical intervention, these things are so important for our health in general.
Now, you've inspired me, because I know how easy it is just to sort of get in a rut and you're busy with work and school and whatever it is that you have going on. It's hard to stay, keep that mindset oh, yeah, we need to get outside. We need to, let's try to eat healthy. And maybe it's just a little bit at a time, and thinking about it helps us to get there, all of us. It's really good advice. Well, thank you so much for our conversation today. I know I learned a lot, and I'm sure our audience learned a lot as well.
Thank you. Thanks for having me.
Thank you, as always, for listening to Boston Children's Answers Parentcast. Special thanks to our guest parent, Kim, and our guest expert, Dr. Margaret Stefater Richards. If you want to hear more and stay up to date on the latest episodes, be sure to subscribe to our podcast wherever you listen. And if you'd like to learn more about our episodes and podcasts, feel free to check us out at bostonchildrens.org.